I'm Tammy Rome. I'm a licensed professional counselor here in the state of Kansas, and I specialize in working with clients who have migraine and other headache disorders. So we're going to be talking a little bit about the emotional and cognitive symptoms that are normal part of migraine, and then those that maybe are a little more of a warning signal, because we know that up to 60% of people with migraine also have a comorbid anxiety disorder. And for episodic patients, the rate of major depression is 20 to 30%. And for chronic migraine, that jumps up to 57%. And that puts a huge additional burden on all of us to have to deal with a mental illness on top of the difficulty of dealing with migraine. And the symptoms of migraine and its emotional ups and downs can get confused with those symptoms. And we need to know when it's normal, it's just part of what migraine gives us, and when we need to be more concerned about talking to our doctors and seeking mental health services. So let's talk about the prodrome, that early warning before the pain hits. We can have all kinds of crazy symptoms, and some of those include mood swings, irritability, depressed mood, and maybe the opposite. Maybe we have euphoria, and any of those things can happen. We can have difficulty thinking, communicating. Our words just won't come. As the migraine progresses, we might even have aphasia, where our speech is garbled, or the words don't come out right. We can't think of the right word. And all of these are normal parts of migraine. Anxiety can be a part of a migraine symptom itself. And then once the pain is in full swing, that can set off a cascade of disruptions to our dopamine levels and our serotonin levels, and they take a dive, so that we can find ourselves struggling with depression and anxiety throughout all the phases of the attack, and even into that post-drome hangover where we just feel so exhausted we really can't think straight at all, and that can continue. But sometimes we face anxiety or depression that is, it's connected more to the fear of a migraine coming, or we may find ourselves with a depression, insomnia, lack of appetite, thoughts of death or dying, and we may not have a lot of energy. We might move slowly, speak slowly, and those are signs that if these things are going on between attacks, and they are happening to us even when we have longer breaks between attacks, we can find that we need to start talking to our doctors, and we need to start seeking those mental health services, because we just might need more than good migraine care during those phases. So feel free in the process of this to put your questions out there. We've got people ready to answer them. And if I see something come up, I will try to answer it the best I can. One of the things that happens with migraine, and a lot of us talk about this, is we fear the next attack. We are afraid that our meds might not work. What if we end up in the ER? How are we going to be treated? What if we have to leave work? How will our boss treat us? What will our coworkers think? And we build these things up in our minds, and then we become consumed with all of the what ifs about migraine, even when, excuse me there, I had to change hands. We are shooting this from my cell phone, not my laptop, so it's a little bit different than than what we were expecting. And I apologize for dropping the phone. This is real life. Good question. Why do they end up diagnosing us with conversion disorder? Well, part of the problem is that the mental health system historically has not treated migraine patients very well. And so they don't really find, they can't find a physical cause, and they might not understand the process of migraine, particularly with hemiplegic migraine where you've got more stroke-like symptoms. If you aren't dealing with a mental health provider who understands how migraine affects your body and your mind and emotions, they can just make that that assumption that this is a conversion disorder and that the symptoms are of a psychological origin rather than a physical one. And that's why it's important when you're looking at getting mental health services and you have migraine, that you ask some very important questions of your psychiatrist and your therapist to gauge their understanding of what migraine is. I will tell you from personal experience that the training for therapists regarding migraine in school is abysmal. It really is a sad joke. And so you really do need to ask. And one of the ways that you can find out is if you go to the AmericanMigraineFoundation.org, in the Find a Doctor button at the top of the page, you can choose to get a list of doctors who are in the mental health space, psychiatry, counselors, psychiatrists, so that you can get a list of those providers who are more knowledgeable about migraine and are less likely to blame you or to blow it off as a psychosomatic reaction, and they'll take you seriously, that you are really dealing with a serious neurological condition. I just saw a comment here that it talks about a vicious cycle, that fear of migraine brings on anxiety and depression, and then that can set off the stress response that brings on a migraine. And it really is a vicious cycle that we need to be able to break and get a good therapist who understands migraine and understands that sometimes that anxiety is part of the migraine process, and can really coach us through the physical symptoms of anxiety and how to diffuse that. Breaking the cycle, it's tough. It's tough, and you really do need to find a therapist that you can trust and build that good rapport with, who gets it that you are dealing with a neurological condition, because it becomes its own feedback loop. The body's stress response system is really good at reacting to our fears, and it becomes this false alarm that just keeps running and running and running, and you've got to have a really skilled therapist to work with you. And that's why it's so essential, if you are dealing with any kind of anxiety or depression in addition to migraine, that you do have a good therapist that you can work with. It's very hard to break out of that cycle, and one of the hardest things is if getting good social support from your loved ones and from your friends and coworkers, so that you've got that background to give you the support. Doing this alone, it's much, much harder, and much more important that you pay attention to getting treatment for migraine and treatment for the emotional fallout of migraine. They are treated differently. Your neurologist will treat you with medications and other treatments to help prevent attacks and stop attacks. But your therapist is going to help you deal with all the emotional fallout. And that's important that we have that. Yeah, lucky to have a good support. I am lucky too. I've got a family full of people who have migraine, and so that matters a lot to have people around you. And if you're in a situation, you're watching this and you really don't have anybody around you, stick with us, because sometimes your best support are not the people you live with. They're not the people that you are related to. But we're all migraine patients. yeah, I'm a therapist, I'm a mental health provider, but guess what? If you've been watching, I'm a migraine patient too. I was diagnosed with chronic migraine, migraine with aura, migraine without aura, and I also have chronic cluster headache. And I've had to learn how to manage my own health so that I can continue to help others. Love the tips that are coming in. People are sharing about how the different medications that can work. Let's talk about medications and kind of the crossover between your migraine medications and medications for mental illness. Often you can find treatments that will be double duty and help you in both areas. There are some antidepressants that have been shown to help prevent migraine. Amitriptyline is one of the most common. But talking with your doctors, if you see a psychiatrist, you get medications for a mental illness, getting your psychiatrist and your neurologist to talk to each other and not overlap or over-medicate so that you can try to have the fewest side effects with the best results. Hey, Julie, hi, I just saw your comment about meditation and mindfulness. There's a lot of research to support the use of mindfulness-based relaxation to help us reduce the anxiety. And when our anxiety levels go down, that fight or flight eases. We tend to be less on high alert. And so it can actually help reduce our pain as well. And so if you can find somebody to coach you through teaching you how to do biofeedback or meditation, mindfulness, using yoga practices, and Tai Chi even, sometimes even just taking a walk can make a huge difference in how you feel, especially in the middle of an attack when our brains just start going with all of the worst case scenario options of how this could play out for you. I hear a lot of people who say they'll get an attack and then they start worrying about how bad it's going to get and whether or not their medications are going to work for them. So being able to use mindfulness strategies in the process of the migraine can bring that anxiety level down quite a bit for everyone. One of the treatments that isn't talked about a lot that I use in practice is dialectical behavior therapy. It was originally developed to treat borderline personality disorder, but it turns out it's very effective for a lot of problems, and it's been very effective for my migraine clients because it specifically teaches skills on how to bring down that anxiety, which is very important. We do that. So let's talk about, we've got the migraine going on, and we know we're going to have mood swings. We're going to get depressed. We're going to get euphoric. We're going to be anxious. But what about kind of some red flags that maybe there's something more serious going on? When we start to have days when we take to our beds and we hide even when we don't have migraine, and maybe we stop eating, or we emotionally eat, we sleep all day, those are flags. When we just can't pull ourselves out of that funk. And the migraine itself can also put us in that funk just from if you have days and days of migraine, if you're someone who has chronic daily headache where you don't get breaks, that in and of itself can really pull us down into the level of major depression, where we need to treat both in order to get an effective treatment. That is something definitely to watch out for, especially if you start having thoughts of suicide. When you start thinking that maybe you'd be better off if you just weren't there. Your family would be better off if you died. Don't hold that in. Tell somebody. Tell a friend. Call the hotline. Come onto the Move Against Migraine group. We've got admins, moderators who can help you get those resources. What we don't want to do is see you struggling there all alone and feeling like you don't have anywhere to reach out to, because you do. And I moderate there at the Move Against Migraine group as well, and I usually get tagged if somebody's really having a rough time to give some resources, and we're certainly here for you, because we all live this, and we know how bad it can get and how hard it can be to face migraine alone. It's a tough one. Hi, Stacy. Just saw that you've been dealing with migraine since you were 8 years old. Yeah, I've been living with them since I was 5, so I know how it is to live with migraine all of your life. That can be a very different, kind of different, because when you've got it going on that long, part of it is that it becomes part of your lifestyle, and at the same time, those around you, because they're used to you having migraine all the time, don't realize the emotional toll that it really does take on you. And that's kind of a different experience than those who start getting migraine attacks as adults. Let's talk about how this is, just affects us in terms of our careers, because that affects us too when we can't work, and or we don't have supportive employers. We have coworkers who are difficult, resent us for having to take time off. Being able to communicate with them effectively. Mental health services can help you with this when you are working with a therapist who truly understands the toll that migraine takes. They can also help advocate for you with accommodations in the workplace. Sometimes you need a filter on your computer screen, or lights turned down, or a different type of lighting, and these things are sometimes difficult to ask for, and can sometimes be better received. That request can be better received when it comes from a healthcare professional. I know I've advocated for plenty of clients over the years to help get those accommodations in the workplace and allow them to stay working. I like that attitude, Jill. Migraine disease did not ruin my life. It just changed the trajectory. It certainly did. And that learning how to live that life. I remember my daughter telling me that, and she started getting migraine when she was 2 years old, telling me that when it came time to decide on a career, she only considered career options that were migraine friendly. Because she knew that she would be living with that, and she still needed to earn a living. And I think, I know I didn't think about that when I was looking at careers. And that was very wise of her to try to find a migraine-friendly career, if there are any. I guess it depends on your symptoms. Accessing FMLA, someone just mentioned that. That can be an important part of job preservation. If you work for an employer who is required to provide that service, I know that sometimes people work for small companies where those options are not available, but having someone in your corner in a mental health capacity who can speak on your behalf. I've done it for people who work for small employers who really don't think they can afford to make accommodations. A mental health provider who helps with migraine ends up being a coach and also ends up being your advocate. And also helping you with communication skills of how do I communicate migraine to people who just don't get it, and how do I deal with the difficult people in my life who are never going to get it. These are all issues that we face. I know that someone was talking earlier, and I don't remember if it was on the Move Against Migraine group, about guilt and about the fact that we can get ourselves caught in the cycle of feeling guilty, wondering what we did to bring migraine on, wondering what we did to cause this particular migraine attack. My comment to her was that it's really common, and I think a lot of it is fueled by stigma. Not only the stigma we get from other people, but the stigma that we internalize ourselves when we start to blame ourselves for not catching the trigger, for not knowing to, for taking an unnecessary risk. And that can become very poisonous to our mental health, to let that guilt really feed, kind of grow. It's important that we counter that, remind ourselves that this is a biological illness. It's not a moral failing. We didn't create this. It's not psychosomatic. It's not a conversion disorder. It is a disease. It's a neurological disease. Holding on to, what am I going to do? How am I going to provide? My kids are missing out. I've missed, concerts and ball games. I'm not holding my weight with my partner. Those can really weigh on you. And it's important that you keep the lines of communication open with your loved ones and let them know how much you want to be involved and you want to participate in the family. And on the flip side of that, one of the hardest things to do as a migraine patient is to listen to your loved ones express their frustration with migraine and give them the opportunity to be angry and to be frustrated about migraine disease itself, and what it does to the family. Those are legitimate feelings, and they're hard to sit there and listen to. And if you struggle with being able to share that back and forth conversation, it might take a couple of sessions of couples therapy or family therapy to have that professional third party help to facilitate that conversation, because we have our emotional response to migraine and the fallout, but so do our loved ones. I like to say that migraine is a family affair. It doesn't happen in isolation. It doesn't happen to just us. It happens to everyone that touches our lives. And that can be really hard to cope with when we see the pain that migraine has caused our loved ones. And we can be tempted to internalize that and take that personally and blame ourselves when it's not us that's at fault. It's migraine. It's a neurological disease that has invaded our lives. And reminding ourselves of that, and remind ourselves that this is not something that we created. A long attack. Let me tell you, I hear you, Susan. You're forced into isolation, and you don't you can't talk to anybody. You can't really reach out to anybody. You're too sick. And so the mind can go to some really bad places with that. One of the strategies that I use to kind of counter that is to create some playlists of inspirational music that I can play quietly. Nothing that's going to hurt my head worse. Things that have meaning for me, that remind me that I'm a worthwhile person, migraine or not, and that this is real, and I'm just dealing with a disease. And so music can be, because we can't read, you're not going to sit there and turn the light on and start reading something inspirational, but the music, hearing those words, or if you have some meditation CDs, some guided meditation where you can get that positive affirmation. There is a website called Calm that is very good at, if you want to access that, I'll get the URL and post it after the conversation. And I find it very helpful for facilitating meditation and relaxation, and to get my mind out of that self-blame that can come with it. We are getting close to our half hour over with. Is there anything else that we haven't covered that anyone would like me to address in terms of, either a mental illness or the emotional effects of migraine itself? I love that, what Jamie just said about hearing another person's voice, sharing words. I am speaking to you, Gina. Absolutely. You are amazing just because you are here. I'm sorry that you were denied disability. That's a hard one. A lot of people do. If you need tips, there are people on the Move Against Migraine site that have done the application process, me included, who can help you with that. But I'm one of you, but I'm also here to help and give you tips, and I'm around, so you can always just tag me and say, hey, I got a question. Happy to do so. Love you all. You are my tribe, and we're in this together. We're gonna change the world for the better for all of us, just by coming out of the closet, talking about it, being real, and saying, our mood swings, they're just part of the disease. That anxiety is so part of this disease. And it's okay to say so. It's okay to say, this is migraine. Have a good night. Have a migraine-free night if you can. If not, grab your ice packs, grab your meds, and I will catch you later. Have a great evening.